Welcome to the Psychogastroenterologist, the show where we explore the fascinating intersection of the brain-gut connection through a multidisciplinary lens informed by psychology, neuroscience, and gastroenterology, better known as psychogastroenterology. Our mission is to delve into the gut-brain axis and uncover how this powerful connection influences mental, physical, and overall well-being. Whether you work in behavioral health, healthcare, the criminal justice system, or health and wellness coaching, this podcast offers insights to inform and inspire your work. Join us as we break down complex concepts, share evidence-based perspectives, and discuss emerging trends in this rapidly evolving field. The information provided in this podcast is for educational purposes only and is not intended as medical or mental health advice. The content discussed should not replace professional judgment, diagnosis, or treatment. Always consult with a qualified healthcare provider regarding any medical or psychological concerns. The views expressed by our hosts and our guests are their own and do not necessarily reflect those of any affiliated organizations.
Welcome back, everyone, to episode 6. In this episode, we're going to talk about migraine and how it relates to the gut-brain axis. It is a complicated relationship. There's a lot of moving parts. We'll dig into some of these parts today. My name's Jerrod. I am the host of the podcast program. Here's my email address on this particular slide. If you are listening to this and you want to see these slides in a visual format, please check out our YouTube channel. If you're new to our podcast program, here is a copy of my brief professional biography. I wear a couple different hats. I have a number of different degrees, including a doctorate degree, several master's degrees. I'm a professor, trainer, researcher, consultant. Been doing quite a bit of work now in the area of migraine. Actually published an article recently with some of my colleagues, did some focusing on this topic in one of my master's degree programs and really looking at this topic through a behavioral health, a nutritional neuroscience, and a lifestyle medicine lens. And we'll be weaving in some discussions about neuroscience today as well. And if you really want to get into the weeds of understanding migraine, I do think looking at it from those angles as well, and probably including the biopsychosocial model approach, can be very helpful. These are some areas that guide and inform my work. So if you're listening to this, I do a lot of work in the area of neurocriminology, neurocounseling, psychogastroenterology, lifestyle medicine, and many more. And throughout our podcast program, I'll be talking about many of these different topics in relation to the gut-brain axis. Our agenda for today's talk is pretty straightforward, and I always have to say this on all of our talks. This is just for general education purposes only. Please consult with qualified professionals before implementing any of these things that we're going to be talking about today. But part 1, I'm going to give you a really broad overview of migraine. Part 2, some different things you might want to consider during a professional intake or screening process. And then part 3, focusing on tips, strategies, solutions, and interventions. So migraine, it's a complex topic. It's a fascinating topic. There's been thousands and thousands of articles written on migraine and related topics over the past numerous decades. But visually here, if you can see this, and I'll talk about it verbally, obviously, as well. Why do I focus on migraines? Well, if you look at some of the research literature, it is one of the leading causes of disability worldwide. What are some other leading causes? Depression, other forms of chronic pain. And what I will say is, folks dealing with a lot of depression may have higher incidence of migraine. Folks dealing with higher incidence of migraine may be more prone to be dealing with depression. So there's kind of a bi-directional relationship. So migraine, let's just break it down. What does the research literature say? Well, it's a complex neurological disorder. Research also leans in the direction that it's often underestimated, underrecognized, underdiagnosed, and undertreated. Why? Another big reason why I'm focusing on this topic is the fact I think a lot of people believe that only healthcare providers, medical doctors, play a role in migraine treatment and management. That's not the case. Behavioral health professionals can play a huge role. Occupational therapists, PTs, physical therapy, nutritionists. But when we talk about medical doctors, obviously they're going to be the ones who officially diagnose this and prescribe medications, or like a nurse practitioner, physician's assistant. But some of these allied fields can play a huge role as well in helping clients better understand and manage migraine intensity and frequency. Migraine is a significant public health challenge. It impacts children. It impacts adults. It can impact people across the lifespan. It's not just a public health challenge. It's a clinical challenge. It's a challenge for our education arena and many other settings. So when somebody is dealing with a migraine, and I've never personally dealt with one, but I do have friends and colleagues who deal with migraine. And from what I hear from them, it's no joke. It can really impact overall quality of life. Everybody is different who has a history of migraine. But what the research says in a nutshell, people with ongoing migraine severities and intensities, they're at greater risk of experiencing co-occurring mental health problems, depression, anxiety. It can contribute to loss of income. It can get in the way of relationships. It can impact sleep health, and the list goes on. So migraine, when we look at this, and if you can see this slide visually here, it is one of the major kinds of illnesses worldwide that contributes to disability. And the statistics are all over the map, but you will find plenty of statistics that indicate that as many as 1 billion people worldwide do deal with migraines on some level. That is a astronomically huge number. Here's a really interesting article that provides some additional statistics, but let's just talk about this briefly. If we look at migraine in the United States, some research indicates it may impact as many as 1 in 6 adults, which equates to around 32 million people. It may impact as many as 8 to 9 million women, and close to 2 to 3 million men. So if we look at this from a gender lens, women are more likely to be dealing with migraine than men, but men obviously still deal with it as well. Global prevalence rates, if we just break down that number, we have research indicating that anywhere between 9 to 18% of the worldwide population does deal with migraine on some level. Here's another important statistic that I think is another reason why we are doing an episode on migraine. Some studies indicate that as many as 70% of patients with migraine do not seek medical advice or medical care. There's a variety of reasons for that, and that's why we want to educate not just medical doctors about these topics, but all these other allied fields of study. Behavioral health, chemical health, trauma specialists, educators, people that work in the criminal justice arena, human service professionals, anybody working in the helping professions. You're probably coming into contact with individuals all the time who have a migraine. And maybe we never know about it because maybe we never ask the questions. Migraine is very, very complicated, and there's many dimensions of it. There's many subtypes, but a migraine, if you look at this slide here, it's a recurrent headache disorder. The duration, and this can differ from person to person, of course, may last anywhere from 4 to 72 hours. Again, you may have some people that can go on longer than 72 hours. And visually here, for a period of at least 3 months, on more than 15 days per month, and the headaches have migraine characteristics more than half the episodes. So, and the diagnostic criteria for this is kind of outside the scope of what we're going to be talking about today, but this gives you a little general overview. I would recommend becoming familiar with the International Classification of Headache Disorders. You can just Google that. You can find things online about that. What are the phases of migraines? Well, visually here, what do we have going on? We have the prodromal stage, aura stage, the headache stage, the postdromal stage. Not everyone would go in each of these stages, but typically this prodromal is going to be the first phase, the aurora phase, typically the next. You got the headache again that lasts anywhere from 4 hours to 72 hours. And then that postdromal stage, you'll find literature that this has been referred to almost as like a migraine hangover, almost like an alcohol-induced hangover. And again, everybody is different, but the symptoms for each of these phases can be different, of course. What are some of the key mechanisms involved in migraine? Again, this is where it gets really complicated. This is not an overarching, we're not covering every aspect, but these are some of the big ones we'd want to be aware of. This first one here, if you can see visually, this cortical spreading depression. This is basically an electrical physiological foundation of migraine aura. There's a lot of good research literature on this. The second one here, neurogenic inflammation, we definitely want to be aware of neuroinflammation. Oxidative stress is a huge topic. We'll be talking about oxidative stress at various times in future episodes. What's this next one here? If you take a look at this one, activation of the trigeminal vascular system, basically in a nutshell, and you have research literature indicating that this may be one of the most important areas to really hone in on and understand when we're trying to figure out what truly causes. This is a major pain signaling pathway in the brain. This is also a functional neurovascular network. There's a lot going on here. If you just Google this, you will find countless articles. And then also vascular dysfunction is talked about as a potential mechanism. And again, this is not an all-encompassing list, but this is a good starting point to think about. So if we break it down a little bit further, what are some other variables that we want to think about and consider? Well, there's a lot of variables. There's environmental factors. There are genetic variations. There's a number of people that experience migraine because of genetic factors. We also want to be aware of mitochondrial dysfunction. This really goes to the heart of cellular energy. A very high percentage of people that deal with migraines also experience a variety of co-occurring conditions. Could be psychiatric conditions. It could be other medical conditions. Very, very important to consider the fact that we need to also have an appreciation and target these co-occurring conditions. What are some of the more common comorbidities noted in the research literature that have been found to be higher among folks with a migraine? And you can have plenty of people that have histories of migraine that may not be dealing with any of these things. But again, let's just break this down a little bit. Higher rates of depression, anxiety, fibromyalgia, sleep disorders, irritable bowel syndrome, and various cognitive complaints have been noted as common comorbidities. Other ones here, just breaking this down further, you work with folks with post-traumatic stress disorder, panic disorders, history of stroke, multiple sclerosis, and even epilepsy, incidence of migraine as well. So we need to understand the interconnectedness between some of these conditions and migraine. Migraine impacts kids as well. So in pediatric populations, you have some studies that say as many as 7.7% of children and adolescents may be dealing with migraine. So very important if you're working in pediatric care to have an appreciation for this topic. When we're talking about pediatric migraine, there's a multitude of factors to take into account. This slide here visually shows some of them. We need to be aware if that child or teenager has a history of adverse childhood experiences. We need to really understand family dynamics. We need to understand maybe a parent is dealing with a severe mental health condition. Maybe that child is dealing with emotional dysregulation, or they're dealing with some other kind of life stressors. These are important variables to consider when we're looking at it through a pediatric migraine lens. What about during the pregnancy process? This is another variable we need to take into account. What happens if mom is pregnant and has a long history of migraine throughout the pregnancy process? Well, that in and of itself could increase the risk of different kinds of complications. And this slide here points out at least 6 potential complications that could result. So very, very important to work with healthcare providers when we're talking about migraine during pregnancy. If we put on our neuroscience hats right now, there's a lot of neuroscience research that's dug into migraine. What's going on in the brain of someone with a migraine in some cases? Well, we really need to be aware and have an appreciation for mitochondrial dysfunction, neuroinflammation. In some cases, there could be some gray matter volume reduction. And in other cases, the person may be dealing with impaired brain glucose abnormalities in how their brain processes and metabolizes glucose. When you study migraine, it's very important to also understand the autonomic nervous system. Typically, when someone's dealing with a migraine, that will likely indicate that their autonomic nervous system is not working at optimal levels. And when we're talking about migraine and co-occurring autonomic nervous system dysfunction, the client may be dealing with higher incidence of nausea, light sensitivity, odor sensitivity, and sound sensitivity. When you study migraine, it's equally important to also understand the HPA axis. That's the hypothalamus pituitary adrenal axis. Research indicates that this axis may be dysregulated and could be a contributor to migraine. This axis is our body's main stress response system, and it's a hormone regulator. And the end product of this axis is cortisol. Now, when we think about autonomic nervous system dysfunction in conjunction with HPA axis dysregulation, and the person's dealing with a lot of stress, what may be more prone to experiencing migraine, digestive health issues, dizziness, panic attacks, anxiety issues, to name a few. Very, very important to understand that in some cases, migraine could be triggered by metabolic dysregulation. That could be disruptions in glucose and insulin levels, cholesterol, things of that nature. Very, very important to understand that relationship as well. Now, how does this relate to the gut-brain axis? Well, you have plenty of studies that show that gut dysbiosis, abnormalities in the gut-brain axis can absolutely play a role in migraine and triggering of a migraine. Let's break this down a little bit. So we've learned about gut dysbiosis in previous episodes, but basically, again, what this is an alteration of the gut microbiota and the composition in the gut and the metabolism in the gut. And when we're dealing with gut dysbiosis, that typically is going to contribute to abnormal signaling or disruptions between the gut and the brain. And it could play a role in triggering or exacerbating migraine intensity. When somebody is dealing with gut dysbiosis, that could contribute to more problematic food cravings, mood instability. It can play a role in compromising our immune system and overall health and well-being. There's a multitude of factors that can contribute to gut dysbiosis: obesity, junk food, smoking cigarettes, high levels of stress, exposure to environmental toxins, being on tons of antibiotics for a long period of time can actually cause more gut dysbiosis. Breaking this down, if we look at some of the research literature, you can see here visually that migraine and gastrointestinal symptoms are elevated in some people. You might have more nausea, diarrhea, vomiting, IBS. We'll talk about IBS in future episodes as well. Functional diarrhea is another topic you want to be aware of that may be more common in some people with migraines. And that should alert you to the fact that there's probably something going on with the autonomic nervous system that is not working properly. So what is functional diarrhea? Well, it's a functional gastrointestinal disorder. And typically, if somebody went into the doctor for this and they ran a lot of scans and did a lot of tests, they're probably not going to find like structural or biochemical abnormalities in a lot of the cases. So it's kind of a diagnosis of exclusion. But what can cause or contribute to functional diarrhea? Well, in some cases, there could be some physiological factors at play. So maybe that person is dealing with small bowel bacterial overgrowth. Maybe the individual is dealing with a ton of anxiety and stress. Maybe it's a medication side effect. Maybe the person is dealing with some post-infection changes in their body. Maybe it has to do with what they eat as well. So there's a lot of factors to take into account here when you are talking about this through the lens of functional diarrhea. Here's another topic just to plant the seeds with all of you, but if you can't see this, adipose tissue is another factor to consider, another layer here. So when somebody has a lot of excessive fat, body weight, especially around their midsection, be aware of adipose tissue abnormalities and metabolism abnormalities. That could be a factor in some cases. Why is that a factor? Well, one variable you'd want to look at is abnormalities with leptin. That's a hormone. Typically, people can go to their doctor and get a leptin test. That would be a variable to take into account. There's a whole line of research literature in the migraine world that talks about the obesity migraine link. That could be a factor in some cases. And when somebody's dealing with excessive adipose tissue, basically that's excessive fat accumulation, which could be a factor in more insulin resistance and musculoskeletal kinds of issues, to name a few. So GI disorders here, we all know about GERD, acid reflux, things of that nature. So definitely be aware of that topic. Be aware of the topic of H. pylori. Be aware of the topic of certain kinds of ulcers. These are different variables we want to consider for looking at this through a migraine and gut gut-brain axis kind of lens. Another variable here that I think it's very important to be aware of is the vagus nerve. And the vagus nerve is the main nerve of the parasympathetic nervous system. So it has a lot to do with communication between the gut and the brain. We'll talk about the vagus nerve in future episodes as well, and polyvagal theory and why that's so important to be aware of when we're studying these topics. Breaking this down here too, as you can see this visually, somebody with a migraine may be dealing with dyspepsia. So basically, functional dyspepsia is going to be more upper belly discomfort. It's another one of those functional kinds of disorders where the person may go into the doctor, they run a lot of tests, and the test may come up as fairly normal, where you don't know what the root cause is. But functional dyspepsia is a big topic you'd want to be aware of. We all know about constipation. We had an episode on that. Being aware of inflammatory bowel syndrome, celiac disease, just in case you're not familiar with that. Basically, celiac disease is an autoimmune condition where our immune system kind of abnormally reacts to gluten. So somebody is dealing with a lot of gluten insensitivity. And then on this slide too, I have H. pylori underlined. So that's another big topic. So H. pylori is a type of bacteria that can adversely impact the inner lining of the stomach and other parts of the small intestine. A lot of people have H. pylori in their system and they may never know that they have it. But some of the symptoms associated with H. pylori are going to be unexplained weight loss, indigestion, nausea, vomiting, bloating. It is another variable to take into account and maybe talking to your doctor about getting tested for that. So if we break this down and looking at it visually, if you were to go through the literature and everything I just shared up to this point, how does migraine relate to gut-brain axis dysfunction? What are some of the shared contributors we need to be aware of? We need to be aware of our autonomic nervous system and the dysfunction, the HPA axis. We need to be aware of metabolic imbalances, stress factors, gut dysbiosis, intestinal permeability, which is leaky gut, dietary and nutritional factors and deficiencies, chronic low-grade inflammation. There could be a serotonin dysregulation, and it could be triggered by certain kinds of medications. As we move into our next section, interviewing intake screening considerations, I'm a major fan of the biopsychosocial model, and it is supported in the migraine literature that if we're going to have a really holistic and integrative and multidisciplinary informed lens, look through this through a biopsychosocial lens that takes into account biological, psychological, and social factors. It's more of a holistic lens. It helps better understand the entire person. And again, like I mentioned before, I think it's very important to understand the comorbidities that are very common in folks with migraine. The more we can understand and screen for them and target them with intervention, that's only going to help that individual. Comorbidities could be psychiatric, it could be gastrointestinal, it could be other physical health comorbidities. We need to be aware of some of the common triggers for migraines, and it can vary from person to person. Stress could be a trigger, changes in the environment or climate, missing a meal, overeating, loud noises, bright lights, drinking alcohol, smoking cigarettes, overexertion, where maybe someone overexercises, getting too much sleep, not getting enough sleep, too much caffeine, or trying to quit caffeine. It's all over the map. There is some research literature also to lean in the direction that in some cases, some people with a migraine may also be dealing with more executive function impairment. And if you're working with somebody who has executive function impairment, that really goes to the heart of planning and reasoning and decision making. It's the boss, the CEO of the brain. So really understand executive function capabilities. Maybe you work with a client that's had a lot of adverse childhood experiences. Even if you're working with an adult, having an appreciation for the ACEs research is so helpful, because maybe your adult client unfortunately dealt with a ton of childhood trauma that could be playing a role in their migraines in adulthood. And if you can see this slide here visually, if you work with clients that have had a lot of childhood trauma, and especially if that childhood trauma went unmanaged, treated, and addressed, in some cases, that individual, as they become an adult, may be dealing with more health-related problems, including migraines and digestive health issues, amongst many more. Other factors to take into account, obviously, we need to be aware of the individual's level of stress. How do they cope with adversity and hardship? What's their social support system like? And the research says have an appreciation for your client's attachment patterns. That may be another piece of this puzzle. Excessive screen time exposure could be another factor here. So if you are working with somebody who has migraines, dig into their screen time patterns. Maybe that client is on the screen for so many hours a day, and maybe they're up really late at night on the screen. That in and of itself could be a triggering event. Another piece of this puzzle is alexithymia. There's several articles that point to the fact that some people with a migraine may be dealing with higher levels of alexithymia. If you're not familiar with that term, alexithymia is emotional blindness. This is when somebody really struggles with naming, labeling, and processing emotions. Screen for sleep issues. Sleep disturbances, very common among people with migraine, and sleep disturbances can trigger a new migraine in some cases. Need to be aware of the topic of migraine-related stigma. This is a big issue in some people who deal with migraine. So really be aware that stigma is common. This is a stressor, and this can be a full-blown trauma for some people. Be aware of dietary triggers. Another good reason why it's so important to consult with or work with dietitians and nutritionists. Dietary triggers could be someone has a lot of MSG, alcohol, they're dehydrated, maybe they get a lot of nitrates, or they're consuming a lot of aspartame. These are all potential dietary triggers for migraine. Food insecurity, another piece of this puzzle. If you work with somebody who's dealing with food insecurity, there are research studies that do support the fact that food insecurity could play a role in migraine intensity and severity. How does food insecurity relate to migraine triggering events? Well, the person may be dealing with more psychological stress. They may eat more unhealthy foods, and they may miss meals more frequently. Any one of those factors could trigger a migraine. What about toxic indoor mold exposure? Another piece of this puzzle. Maybe you work with somebody, lives in a really old home. Maybe they live in a home, there's been a lot of flooding, and now they're dealing with a lot of mold exposure. Mold exposure may trigger a migraine in some cases as well. We need to also be aware that migraine doesn't just impact the person individually. It can really impact that entire family system. So really supporting the entire family is going to be important as well. And our last section today is going to all be about tips, strategies, solutions, and interventions. Well, we're going to be doing quite a bit of talks on lifestyle medicine in our podcast program and why that's so important to look through a lifestyle medicine lens. But when we look at lifestyle medicine, that is a great path forward, in my opinion. And there's some research to support this, that lifestyle medicine can be very effective in the management of migraine. Lifestyle medicine involves 6 pillars: sleep quality, physical exercise, stress management, diet, eating healthy foods, reducing, quitting harmful chemicals, and promoting healthy relationships. When you work with folks with migraine, there's studies that also support the fact that we would probably do well utilizing a trauma-informed care approach and mindset, because having a migraine is not only stressful, it can be very traumatic for the individual as well. As I mentioned earlier, having that attachment lens can be helpful. Anybody doing attachment work, we have studies that talk about the use of attachment-based therapeutic interventions can be helpful for working with people through that behavioral health lens who are dealing with migraine. Being aware of the importance of utilizing psychoeducation and having an appreciation for neuroscience education-based approaches. And you can Google this, but really looking at some of the literature about neuroscience education therapy. There's some good articles that also talk about the use of this approach for working with clients with migraine. So if you're a mental health provider listening to this, there's a lot of things you can do to help people with a migraine. Psychoeducation, helping people learn healthier lifestyle practices, teaching clients more coping skills, helping clients learn about their triggers and then helping them avoid triggers in the future. Having that integrative approach, and maybe some of you do cognitive behavioral therapy. There are some articles that have been published that show utilizing a cognitive behavioral behavioral therapy approach for adults with migraine can be very effective. So what would that look like? Well, this research indicates you would work with the client on enhancing psychoeducation. You'd help the clients cope more effectively with the fear associated with migraine attacks. You would focus on some lifestyle counseling, teach stress management skills, and really focus on trigger management. I'm not advocating for you to go out and do nutrition work unless you are a nutritionist dietitian, but I am advocating for collaboration with these professionals because there's numerous studies that do point to the fact that healthy eating and the right kind of eating can be very helpful in migraine management, as well as having an appreciation for the Mediterranean diet. This slide here has several studies cited that maybe the Mediterranean diet is a good approach in combating migraines. But again, working with those qualified professionals is so important. Maintaining appropriate blood sugar levels is very important as well. And this article highlights the fact that this is a migraine intervention. So if people skip a lot of meals, that can throw off their blood sugar levels. And if people overeat, that can throw off their blood sugar levels. Another piece of this puzzle is exercise, but you'd want to be very mindful of this and work with somebody who has the right credentials around like exercise prescription and maybe somebody that's has some different certifications and licensures in this area. But there are studies that indicate that yoga can be effective and Tai Chi and low intensity workouts, walking, relaxation techniques. But too much exercise can trigger a migraine and not enough exercise can trigger a migraine. So it's very important to individualize your approach. Art therapy. And I have this slide here just to show you that there's so many modalities out there that can be helpful. You have some studies that show art therapy approaches may be very effective for helping people manage their migraines. Here's another reminder that there are a number of digital tools out there and telehealth approaches. This study that was published in 2022 talks about a migraine manager digital therapeutic self-management tool. This would be something to look at. There's a lot of different self-management tools out there that can help people manage their triggers and develop better self-management skills. This is a really neat article that was published in 2014 about the use of a one-day acceptance and commitment training program, kind of an education-based program that may be beneficial for patients who are dealing with comorbid migraine and depression. This is a really good study that was published in 2023 that's called Be Home's Kid Program. So this was a lifestyle kind of approach, 6-session mindfulness-based behavioral practice intervention that showed some positive results when working with adolescents who dealt with a migraine. And again, many mobile tools out there, telehealth approaches. As you can see here, this is a 2025 article that just talks about there's a number of different tools out there that can deliver alternative kinds of therapies to patients who are dealing with migraine. As we get close to wrapping up, I want to plant the seeds here too that we really need to be aware of healthy lifestyle practices and having an appreciation not just for lifestyle medicine, but learn about life's essential 8. You can find that on the American Heart Association. So there's a couple studies that show if you understand life's essential 8 and you use that in practice, that can be very helpful in helping people manage migraines more effectively. What is life's essential 8? Well, this slide sums it up for us. It's really helping clients maintain appropriate body weight, be aware of blood pressure, blood glucose, sleep habits, helping clients quit smoking, focusing on healthy eating practices, appropriate physical activity, and having appreciation for blood lipid levels. That's life's essential 8. And there are some studies that do point to the fact that this can be helpful in migraine management. Thank you everyone for taking time out of your day to listen to our episode. Here's my email address. You can also find it in the show notes, and definitely reach out to us if you have any thoughts or questions, ideas, and also please check out our YouTube channel. Thanks again, everyone. Look forward to having you back to our next episode.
We hope today's episode provided you with valuable insights into the gut-brain connection and its impact across diverse settings. If you enjoyed this episode, please subscribe and share. For more information on this topic, resources, and services, visit pathwayscounselingcenter.org. Thank you for joining us on the Psychogastroenterologist, where mental health and digestive science converge.